Good afternoon. I am Patty Ribicoff, co-chair of the MGH Leadership Council for Psychiatry. I want to welcome you to this special presentation by Dr. Gene Beresin, who will speak on the topic, Coping During a Pandemic, the tools needed for promoting mental health in your children and grandchildren. These are difficult and unnerving times for all of us, but particularly for our young people. What we can do as parents and grandparents and caregivers to help them cope and stay healthy and resilient. We are very grateful that Dr. Berezin has agreed to speak with us today and give us his advice and his wisdom and his comfort. He is a renowned educator and a firm believer that education is key for mental health and well-being.
So much for teeing us up this afternoon. I want to welcome you all to this very important webinar, which will be a series of presentations on coping during a pandemic, tools for promoting mental health in your children and grandchildren. And it's such a pleasure to be doing this with Gene Beresin when I got asked to moderate this afternoon. When I think about who would be my go-to person during a crisis in a way, I think back to my own training at MGH, where Gene Beresin was one of my teachers. And going back now, actually more years than I want to admit, I just remember his sort of compassion, and I remember his intuitive style to responding to questions that residents and junior faculty and others brought to him. I was so delighted, Gene, when I got asked to sort of moderate this important session. And so Gene is the executive director of the Clay Center for Young Healthy Minds at Mass General and is professor of psychiatry at Harvard Medical School. He's also a senior educator in child and adolescent psychiatry at the MGH. Gene has won multiple local, national, international awards. And close to home, he's also received the Cynthia Kettle Award for Medical Student Education by the Department of Psychiatry at Harvard Medical School. He is a trusted, reliable, articulate source. He's a go-to person by the lay media, by TV, movies, just has an extraordinary capacity for translating important information about taking care of young people to both colleagues and also to the lay public. So we're really very lucky that Gene is doing this afternoon. Just by way of background, and I'm sure Gene will sort of speak to this, the Clay Center for Young and Healthy Minds is an extraordinary resource. It has won multiple awards for its ability to provide information in an informative fashion about young people, about clinical care, new research. If you go onto the website, and I encourage you all to do that, you'll see just a vast amount of archived information and fresh information and information that's been added in real time over these last months during the pandemic. As you know, we have a mental health crisis in the context of the pandemic, where young people are suffering actually at a greater proportion than some middle-aged and older people. This is clearly a vulnerable population with unique struggles as young people navigate the pandemic. And so we'll be looking forward to Gene's perspective on that during this afternoon. I'm also delighted and grateful that Evan Welch, who's a member of the Clay Center Advisory Board, has agreed to speak with us this afternoon. He'll talk about his family's experience with the Clay Center and how it has worked and how it has helped them. Before, just as Patty mentioned, you may be muted now, but you won't be later. And so please use the Q&A function, which I will be curating during the webinar. And so we hope to have this very sort of interactive session that I'll be sort of fielding your questions or actually really routing your questions to both Gene and Evan during the Q&A session. And so I will turn it over to you, Gene. And again, thank you. And Evan, thank you for joining us this afternoon.
Thanks, Lee. I'm blushing, but it's such a privilege to be here. I'm going to share my screen. I hope this works. There we go. So what I wanted to talk about today is how we navigate the waters of promoting mental health in our kids and grandchildren. There'll be lots of questions. There'll be, lots of comments are welcome. But I wanted to try to highlight the most important areas. So kids of all ages have three main questions. Am I safe? Are you the people caring for me safe? And how will this affect my daily life? And parents have two major questions, and grandparents, and that is when to worry and when not to worry. So what do we see as sources of stress, anxiety, and depression? And then following up on that, what do we do? And how do we, what's actionable in terms of what we can do? Now, when to worry, the important thing here is to think developmentally. Preschool kids may react to their stress, anxiety, and worries by irritability, by being clingy. They may be a bit more regressed. We may see bedwetting, moodiness, trouble going to sleep, tantrums. School-age kids may have trouble with attention. They have sleep problems often. They're moody. They may be nonverbal. They may complain of somatic problems like headaches, chest pain, stomach aches, and they're worried. Now, school-age kids think in black and white terms. Things are good or bad, right or wrong, life or death. And so when they're categorizing things in that way, when they're worried about, essentially, will I and my family survive? They're also suffering loss, the same way we'll see in teenagers, but they're losing during this period friends, being included, their social interactions, playing with their peers. Now, teenagers have a much more nuanced and sophisticated view about the pandemic. They often know a lot more than younger kids about it, and they, that's both a blessing and a curse because they know what to worry about. Teenagers will respond in a whole variety of ways. Irritability, anxiety, depression, distracted, withdrawn, and you as parents and grandparents are the experts on your kids. When you see behavioral changes, then that's the time to be thinking, is this just a minor problem or is this something I really need to be worried about? But, this is a really big deal for teenagers. It's a time when they want to hang out. They want to go places. They want to separate from their family. They want to be autonomous. They're learning how to be individuals and separate from the family. And a lot of those developmental milestones have been thwarted by COVID. They've missed graduation last year. They missed homecoming this Thanksgiving, hanging out. They're worried about, will the ACTs and the SATs be administered this year? How is that going to help me or not help me get into college? Am I going to get a job? They're not playing on their varsity sports that they've worked long and hard to achieve. So for them, it's a major period of loss. And the other aspect of grief and loss is what's called anticipatory grief. And that is that they're worried and grieving about the future. Am I going to get sick? Am I going to transmit illness to loved ones? And feeling emotionally out of control. So they're struggling. And here we see depressed teenager. Now, what to do? So when you're on the airplane, not that many of us are flying now, but when we were on the airplanes and the flight attendant says, if the pressure drops, put the oxygen mask on yourself first and then help the person next to you. That's exactly what we need to do as parents and grandparents and caregivers. And that is, number one, control your anxiety. Anxiety is contagious, and there have been so many studies to show that we can best help our kids when we can control our own anxiety. And there are lots of ways of doing this, such as get information, but don't flood yourself. Talk with your support system, friends, family, partners. Carve out time for yourself. Take breaks. Pace yourself. Get out of the house. And I think one that a lot of parents that I've been talking with and online and in webinars have been worried about is, how honest should I be with my kids if I'm worried? And the answer is very, because they'll know if you're not telling the truth. And you can say to them, yes, I'm worried, but we've been through hard times before and we'll get through this. So reassurance as well. What's super important for parents as well as kids is self-care. Diet, exercise, getting the right amount of sleep. I'm going to be talking a little bit about cognitive behavior therapy in our toolbox, but taking care of yourself and finding ways to help yourself relax and make sure that you're in decent shape. Now, for kids of all ages, it's really important to ask what they know. What have you heard about coronavirus? How did you hear about it? What are your feelings and concerns about it? And one of the reasons is because if we're going to help craft misconceptions like, will my beloved dog get sick and die? And the answer is no, of course not. And I'm worried about grandma who's living in a nursing home. I've heard that older folks have a harder time with it. Then you can reassure them by saying that she's getting the best of possible care. But the only way we'll know what kids are really thinking is if we ask. And we plan to have frequent conversations with them about how things are going as things move along. Above all, validate their feelings and concerns and be available for these frequent conversations. And as you can see, this mom with a little girl in a mask, they're modeling good behavior, safe behavior, because they have their masks on and they're not touching each other's hands, they're clapping hands separately. Provide reassurance. So things like, remember when the tree fell on the house during the hurricane and we got through that? Or when the pipes burst in the basement. Every family has had its own particular difficult times and got through them. And we'll see over and over again that kids as well as adults love stories, and it provides reassurance. Structure is super important for all of us. And the more kids are home with remote learning, I would structure 7 days a week as if they were school days. Another important tool in our toolkit is using creative arts. Expressing feelings of worry, concern, sadness, loneliness are expressed by journaling, drawing, writing poetry, singing, dancing. Using creative arts as outlets is very, very helpful. This is one time when I would go a little bit lighter on the restriction we typically impose upon our kids and grandchildren for digital media, because having contact with friends is really important, not just for the kids, but for us as parents. And again, the kids need self-care just as we do. My wife and two 11-year-old grandchildren, are out there on the lawn, often doing yoga together. And so we can do some of these self-care techniques, whether it's meditation or yoga or what we'll see as cognitive behavior therapy, together and maintain our own well-being. Now, we do different things with kids of different ages. So preschool kids often respond more to your emotions than to information. So they also need a lot more TLC, a lot more cuddling, playing with them, allowing them to sleep in the bedroom, with parents is often useful. A very important point is turning off the media. A preschooler that hears about a surge in North Dakota with multiple deaths doesn't know how far North Dakota is from Boston. Simply keeping, we're all hostages to digital media. Think of how many smartphones, tablets, computers, television screens, radios that we have on a lot of the time. And the preschool kids, and as we'll see, the school age kids need to have this limited. School age kids, they are very concrete and they want, black and white answers. They need reassurance. They also need the structure and routines. And school age kids work things out during play. So they may play as first responders or essential workers or as doctors or healthcare professionals helping those who have been injured. And when they play, they'll play repetitively. Many parents wonder, is this increasing their anxiety? It's actually not. It's decreasing their anxiety because they're working things out through their play. And again, for school age kids, turn off the media. Now, teenagers are a bit different. because they know more, they're more capable of understanding. And for them, I would actually not turn off the media. I would actually ask them what they're seeing, what they're hearing. Look at Instagram with them, look at Twitter with them, look at news broadcasts with them, and use those as formats to ask them questions about how they understand what's going on. Now, given the losses that we've seen the teens enduring, this is not the time to curtail their digital media. Of course, they need to get their work done, and they need to be able to kind of get their exercise in, or or other stuff, but they need the social contact. And remember, all of these kids, from toddlers to teenagers, are digital natives. Not like many of us, myself included. I'm a digital immigrant. I can FaceTime with my 3.5-year-old granddaughter Sasha as if we're in the same room. It's natural for her. Another important thing is find ways for you and your family to contribute to others who are in greater need than you. So one thing we have to realize is that, a lot was going on before COVID. And this is much like a perfect storm. Um, Before COVID, there were numerous studies by the BBC, by Cigna, many different organizations showed that the Gen Z and the millennial population were more anxious, depressed, suicidal at times, and lonely than any other generation ever. And the suicide rates have been increasing probably by 56% over the last decade. Now, no one knows why this began before the COVID pandemic, but it was a fact. And the reason why prevention and early intervention is so important during these days is because things were percolating along before COVID. And here's my son, Zach, who's now 34 and has a 4.5-year-old and a 1.5-year-old, and I'll show you their pictures in a minute. There are many stress factors prior to COVID. Uncertainty, the loss and grief, the transitions to new schools, to high school, or to becoming seniors, learning challenges among many of our kids that have ADHD or developmental disabilities, and healthcare disparities and other disparities. Families that had low socioeconomic status, lack of internet. 16% of Boston doesn't have internet. And when they say we're going remote, what does that mean for that 16%? They miss out entirely. Among many families, there's lack of fluency in English. So a lot of stress factors have occurred prior to COVID and during COVID. And it's really very important to be in touch with community leaders, with teachers, and with others, and to monitor the stress level that we're all having during this period of time. Pre-COVID, remember, there was a lot of social unrest. There was the hashtag Me Too movement. There was hashtag Never Again. Many of our young people, used activism as a means of exploring their own identity and their worries about the world, worrying about climate change, about the economic downturn. And sure enough, COVID hits, and these don't go unnoticed. Now, another question that many people ask and are concerned about is, what about social emotional learning? I've never heard more interest in this ever before. And what social emotional learning is, and I think probably the longest lived organization that's been involved in this is CASEL, the Collaborative for Academic, Social and Emotional Learning. They look at this as you can see in this slide, self-management, responsible decision-making, relationship skills, social awareness, and self-awareness are embedded in the classrooms, in schools, and in our homes and communities. And many are worried about kids losing some of this during this period of time. The good news is that while they may be set back, they won't lose it. And I'll explain why in a minute. One other striking fact prior to COVID that all of this is embedded in is the issue of loneliness. The BBC did a study that showed that 16 to 24-year-olds are more lonely than ever before, and more lonely than any other sector of the population. So nobody really understands why loneliness has become so pervasive among the Gen Zs and the millennials, but it has been a major factor prior to COVID, and now it's exacerbated by COVID. And loneliness is not insignificant. There's depression and increased risk of suicidal thinking, poor sleep and the consequences of sleep deprivation, inability to self-regulate. So reaching for substances or vaping or smoking to soothe unbearable feelings, and a weakened immune system. So we have to remember that human beings are pack animals and that we need each other. And we have to be aware that loneliness has been and continues to be a problem. Now, how can we keep up with social emotional learning during this period of time? Well, we can do this at home. It's not the same as hanging out with your friends or when you're a teenager, but family activities, many families have told me, I've never had more dinners with my kids and grandchildren than ever before, even though some were virtual. In the community, the importance of clubs and spiritual groups and activities has been incredibly important. I think it's very important for us to be talking with our teachers, our coaches, the folks that actually have contact with our kids, and online. The peers need to be in touch with each other. So I would encourage them to have social contact, just as I would encourage all of us to have social contact online. Joining a group, whether it's a Dungeons and Dragons group, or whether it's a group that's talking about spiritual matters, or whether it's a group about talking about politics. Discussions, conversations are really important. Now, another important mix in the toolbox is cognitive behavior therapy, which is probably the most extensively researched psychotherapeutic tool we know. And in a nutshell, here's what it is. So there's a trigger, and the trigger is I'm housebound, can't see my friends. And then the cognition is my life is ruined. That cognition, that thought triggers an emotion, despair, irritability, isolation, and that responds in a behavior. And maybe that behavior is closing the door and locking myself up in my room. What CBT tells us is that if we can modify the thoughts that we have about our past, present, and future, we can bring them down to a low roar. We can't change reality, but we can change catastrophic, exaggerated, and distorted thinking. So what I say to all of my patients that I explain this to is imagine two lawyers, which you see on your left, or a devil and angel, one on each shoulder, and have a debate. And this can be done either by role playing with folks at home or with the therapist, or folks can do it on their own. So when the devil says, your life is ruined, you'll never be the same again. And the other one says, wait a second, I can see my kids, with FaceTime or Skype. I've done that before. I can text. No, it's not the same. You just got your license and now you're not able to drive. Your life is ruined. But wait a second, this is going to end. There's hope for the future. Things will come back to normal. It will get better. And then the more you argue back and forth and back and forth and back and forth, lo and behold, the emotion of desperation, of despair, of anguish diminishes, not necessarily goes away, and then the behavior changes. And to use another example, the trigger is, let's say the kid is going to be captain of the lacrosse team. And the cognition is, I'm never going to get into college because I can't be on my varsity lacrosse team. The season's canceled. The emotion is the same. It's desperation or irritability or anguish. And the behavior is isolation. And again, the debate. You'll never get into college. You'll never get anywhere. You were going to be a varsity champion, and now you're not. Your life is ruined. Wait a second. There's more to going to college than just varsity sports. And besides, I did it for 3 years. So just because I couldn't do it now, everybody else can't either. Yeah, it doesn't matter. Your life is ruined. No, wait, it's not ruined. I'll be able to play lacrosse, whether I play with a club team or I play in college. And you can see as you go back and forth and back and forth, actually, this can be fun. You can actually do this with a great sense of humor or with playfulness. It doesn't matter how you argue the catastrophic thinking down, as long as you bring the thinking down to a low roar. So, other things that we can do to combat loneliness and loss and grief is turning negative into positivity. So, this gives us a chance to kind of talk with each other about what we've previously taken for granted. And we're all in this together. We're all stressed and share stories. So, I remember my mom, who passed away a couple of years ago at 100, almost 102, used to tell stories of the Great Depression and World War II. And my kids were in rapture just listening to her talking about the radio, and, her father saying, turn that damn thing off. If you want to hear classical music, go to Carnegie Hall. We all have family stories of adversity, and we should share them with each other. Peer activities are important, and organized activities are important. There are plenty of spiritual groups, community groups, organizational groups that kids can join to turn what's negative into something that's positive. Our brains are wired to give. Giving is better than receiving. And here you see this little girl on the left after 9/11 making a contribution, and the boy after the Boston Marathon making his contribution. It's very important for our kids to feel that they're contributing to others. Others are worried about arrested development. Will what we've lost never, ever be regained? And the answer is, in development, there's always a second chance. On the left, we see this individual with 100 billion neurons, each with 10,000 synaptic connections. That's more things than I can possibly count. And on the right here, you see my grandson, Jude, who's 4.5, and his little sister, Remy, who's 1.5. Of course, there are going to be setbacks for them, but they'll get through this. And the good news about development is it won't be lost. It'll just be a bit delayed. And the fact is that we humans are resilient, and there are always ways of catching up, especially if we collaborate with family, teachers, and friends, if we monitor the gaps in development, if we offer online, real-time, and family time to make up what's academic, social, emotional, behavioral setbacks, and that family stability is really crucial for this. And so here you can see, we saw Zach before, stressed out, and here's his twin sister, Glennon, with my granddaughter, Sasha, who I FaceTime a lot, with her baby sister, Casey, and they are connected. And that kind of connection, even though we're outside on my terrace with masks, socially distant, we're connecting, and they're connecting. So another issue that comes up with a lot of folks is, what do we do about back to school anxiety? And some tips for you to think about. Get information, stay in touch with your school, explain to your kids who are just desperate to get back to school that we may have to delay this, that we may be in isolation, that we don't know, but we will get through this. And talk about being with peers again, both present and remotely. And I would ask them what they're worried about and what they miss most. There was a wonderful Sesame Street episode where Elmo was talking about how he misses his friends, and it's a delight for younger children. But keep in touch with your school and keep in touch with other parents and grandparents about what they're doing to manage going back to school. And above all, and there's my son Zach and his twin sister Glennon, who you saw pictures of just prior to this, when they were about, I guess, 2.5. Don't worry alone. So that's a moral that I think all of us need to learn. We will get through this, period. Thanks.
Gene, thanks so much for your comments. We're going to turn it over to Evan. Some thoughts, some comments?
Thank you, Dr. Beresin, who I know is Gene. And I just wanted to briefly talk about how MGH, the Clay Center, and Gene have helped me and our family. the trifecta, if you will. First, our family has a long and deep connection to MGH. My grandparents and parents first met through MGH, and my grandfather was a surgeon at the hospital for over 4 decades. My dad and a close cousin, surgeons trained at the hospital. My mother and grandmother trained as nurses at Mass General, and my grandmother helped establish a flower shop there during World War II. And last, my wife gave birth to 2 of our 3 daughters at MGH in Boston, during which I almost fainted both times, which is why I am not a surgeon. And professionally, I serve as a financial planner in the MGH MGPO's financial planning program, which is an experience that I've found very, very rewarding. I first met Gene back in about 10 years ago, a little over a decade ago, through one of my business partners. And I had moved back to Boston from Atlanta back in 2003 and was having a lot of difficulty finding a psychiatrist in Boston who, met my needs and was a good fit. Diagnosed with generalized anxiety disorder at age 12. I have struggled on and off over many years with powerful feelings of fear and anger, like Gene was mentioning in his presentation. And before meeting Gene, I may have been thriving on the outside, but often not so much on the inside. Gene and I hit it off right from the start. I actually knew he was the guy the first time we had a session. He's since helped me achieve breakthroughs in mental peace by bringing many strategies together: medication, meditation, cognitive behavioral therapy, which he mentioned, and new mental models, to name a few. I'm extremely grateful to be a patient in his private practice, which seems to be very hard to get into these days. I'm thriving on the outside and on the inside today. And a lot of that is because of Gene. And he's helped my wife, Emily, and me in terms of our own relationship, our relationship with our 3 daughters, Charlotte, Gigi, and Caroline. He's even helped 2 of our 3 daughters who have dealt with anxiety and ADHD themselves find the right mental health professionals, so that now both of them are thriving as well. I mean, they're doing very well, even during COVID. And a lot of that is thanks to Gene and his help. He's helped many of our friends. He's been an incredible resource when someone we know has a friend or a relative in a mental health crisis, which we all know happens from time to time. And frankly, he's one of the most influential, knowledgeable, respected, open-minded, helpful, and kind mental health professionals I have ever met. And actually, our business even has Gene speaking to clients and their families this Thursday about resilience during difficult times like COVID. So put simply, Gene is and has been there when people need help, and he really steps up. And I'm very grateful for that. A few years ago, Gene invited me to participate in the MGH Clay Center for Young Healthy Minds. Given the emotional attachment and respect I have for MGH, the struggles I suffered through as a kid, the gratitude I feel toward Gene, and believing so strongly in his mission to help young people access the resources they need so that they may thrive in their lives, I promptly joined as a board member of the advisory board of the Clay Center. And I know that if I had had access to the resources like those provided by the center earlier in my own life, my younger years would have been less painful. Unfortunately, like when I was growing up in the 1980s and 1990s, today it still is difficult for children, adolescents, and teenagers to access the psychiatrists, psychologists, and mental health professionals they need. Given that mental health disorders develop before age 14 for 50% of those who experience them, and I'm an example of that, this gap is why I believe the Clay Center is so important today. The Clay Center has been particularly impactful on young people during this pandemic, as Gene was talking about grandchildren and children. The fact that it provides education in multiple languages and offers an innovative multimedia platform. We know that most young people spend a lot of time online. We are all spending a lot of time online during COVID for obvious reasons, means that the Clay Center is reaching many people. And in fact, the center has the data analytics to prove that during COVID, a lot more people are getting information from the Clay Center. So I'm excited to continue to participate in the MGH Clay Center for Young Healthy Minds so that we may strengthen young people's resilience, help them cope in healthy ways with the challenges they face as they go through the pandemic and after COVID. And so Gene, with gratitude, I thank you and look forward to answering any questions.
Hey, Evan, thank you so much. And Gene, thank you so much. I want to encourage all of the attendees to please use the Q&A function, and we'll take as many questions as possible. We'll also have a mechanism for your sending in questions if there are questions that we didn't get to. So Gene, you make it sound so intuitive, and I was struck, because I've had the luxury of sort of hearing you talk a little bit about COVID and taking care of young people during this just extraordinary time in our history and our lives as families, as a community. And you've talked something about, in a way, sort of loosening up perhaps some of the rules or restrictions or constraints that were sort of part and parcel of everyday life before COVID. And that we sort of have to loosen up a little bit because this is such unique circumstances. But somebody wrote in about, an adolescent, child where extracting that child from her room was just becoming impossible given how tired she was, let alone school all day and all the social media stuff that in a way there were concerns about that. And so my question to you really is sort of where do you draw the line? How nimble do you stay? And at what point do you say, hey, come on out, it's dinner time?
Great question. One of the, there's a group at MGH called Think Kids that does collaborative problem solving. And I would say that what I tell my folks that ask this very question, how do you get to yes? And you get to yes by, there's certain things that are non-negotiable. You've got to do your homework. You've got to, there's certain responsibilities you have to have. Unfortunately, families are not, this is not a democracy. My patients hate it when I say that. But that doesn't mean you don't have a right to kind of voice your opinions and to work things out. And I think that when parents and other family members are collaborating together to kind of work in the structure, build in the breaks, build in the amount of screen time, build in certain, whether they're playing video games or Dungeons and Dragons or whether they're on Instagram, it's their obligation and their responsibility to abide by those rules. And then sometimes they hate this when I say this, I'll quote John Stuart Mill. I said, there was this British philosopher who said, with responsibility comes increased freedom. That means if you get your work done, you can have more screen time, but you've got to get the essentials done. And then you collaborate with each other to kind of make these decisions. If the kid is totally intractable coming out of their room, that's the time, when to worry. And then what to do is to seek some professional help. But in most situations, I think if kids are feeling that you're open to hearing them, to listening to them, to collaborating with them, to bending the rules a little bit, so that it becomes a win-win situation, in most cases, things can be worked out.
And actually, just to follow up to that, somebody sort of wrote in that that they were concerned about a child who had a documented psychiatric disorder, where there was already a history of sort of mixed anxiety and depression,
Yep.
and that during the interval, sort of things were okay at the beginning, but we're into this, Gene, like 9 months, and so symptoms were sort of starting to manifest. Basically, those underlying disorders were sort of breaking through, and the question was really about sort of what's the threshold for sort of picking up the phone and engaging. It's also a challenging time even with telemedicine. So I was hoping you could make a distinction about children where there's a history already of documented mental illness.
That's a great question. I mean, the American Academy of Pediatrics, for example, just came out a number of months ago saying 1 in 3 kids have anxiety disorders that impair their functioning. So we know, so when a child or teenager has an underlying psychiatric condition, remember, you as parents are experts on your kids. And if you see things going the wrong way, it's time to actually increase your seeking professional help and guidance. I mean, again, don't worry alone. It might be a phase, but it might be a worsening of depression or anxiety or ADHD, which is very, very complicated and difficult when you're using Zoom. And you may need to have additional supports, additional structure, and some additional help to actually navigate those waters. So the kids that are coming into this who have underlying psychiatric conditions might need a bit more extra help than those who don't.
Thanks. And Evan, just sort of almost by extension, you were very candid. And by the way, it's nice to listen to Gene Beresin, who's a professor of psychiatry at Harvard Medical School, but we so appreciate hearing sort of the stories, real stories from real patients. So I so appreciate, Gene and everybody appreciates your sort of sharing your story. Could you tell me how, in a way, your journey, because you talked about multiple modalities of treatment, medication, you talked about cognitive behavioral therapy. How does that inform how you sort of think about this vis-a-vis your own family, and particularly in the context of COVID?
Well, thank you, Dr. Cohen. I think that I think one of the best things that Gene helped me with was, one of the things he said to me a long time ago was, when you attack something with multiple strategies, it tends to have better outcomes. And, so I tended to latch on, like a lot of people, to, oh, well, if I do yoga every day, I'll feel great. Or if I take certain medication, that will solve it. And I think over the years, through working with Gene, realizing that multiple strategies together is really what helps me. And I think that's helped me as a parent with our own children, just to, talk to them, obviously, at their level, but to talk to them in a way where I feel like I have a better understanding of where they're coming from. In terms of the pandemic, I mean, one of the things that I did or have been doing, which has been really powerful for me anyway, is we were on a Clay Center call kind of at the beginning of the pandemic. And we were talking about how are we doing and what are we doing different. And I basically decided I was going to meditate every single day into the future, because I'd been talking about doing that for years and I never had done it. And I did. And so now I'm 294 days in, and, it's certainly had impact. And I don't think I would have done that if it wasn't for conversations with Gene. And frankly, also with I think the pandemic is the other reason I was able to actually get there. So
actually, what I think is so cool about your comment is that, as I sit with patients myself in clinic, and we talk about, because Gene was talking about self-care, even 20 minutes of getting getting off of Zoom and walking around the block and just waving to somebody or having a socially distanced greeting. The story is, people have met a lot of their neighbors that they never knew during the pandemic, but sort of even short breaks. It doesn't have to be an hour and a half of a deep meditation, a yoga followed by whatever. It can be a brief period of self-care. Hey, Gene, back to you. Someone asked, talk about threading the needle. Somebody asked about the imminent holidays, and if you hop on if you go onto the CDC website and you see some of the guidance, and people are trying to figure out across America how they're going to manage Thanksgiving, Christmas, breaking plans, keeping plans, staying safe. Can you just give some advice to folks as to, is the needle threadable, as it were?
Well, my own feeling is that when you become a doctor or any healthcare professional, you always weigh the risks versus the benefits. And the risks, I think, are, at least at this point right now, far outweigh some of the benefits of being together. Now, that doesn't mean we can't be creative. That means we can share a toast. We can share a story. We can share videos. We can, when we began the quarantine, my family created a quarantine Spotify playlist, and everybody submitted a song, and we shared them. And right now, I'm looking over at my smartphone. I'm just, I hear it vibrating. I know that my kids all four of them, and the grandchildren are submitting recipes, pictures of their loaves of bread. Try this one out. So there are a lot of things that we can do together remotely if we can't be together. And I'd say, yes, it is sad, but is it worth risking getting somebody sick? Is it, can we, if we can do it in a safe manner, like I have my kids over, we're all masked, we all have masks and we're more than 10 feet apart. It's not the same. You could have an outdoor Thanksgiving gathering with masks and, a fire, or you could choose to do things more virtually and play charades. I mean, tell stories, create artwork together online, but connect. I think the most important thing is keeping things on the positive side and knowing that we will get through this. And it may be difficult now, but there's always hope and there's always something positive to come out of this. And be creative and improvise and do things together, albeit remotely and digitally. There's we all have rituals during the holidays, and try to maintain those rituals, even if you're doing it online. And if you can't, you can't. But we have to learn to cope with it and see the hope for the future, even if we can't be together this Thanksgiving or Christmas.
Because what you're really saying is we may not be able to be together in the way we have been together historically, but that's not a line in the sand, because there's a way to sort of stay connected as best we can. And it's really helpful, particularly at this time of years as the days get shorter and we know that Thanksgiving is around the corner. I want to be respectful of time. I also want to thank you, Gene, and I want to thank you, Evan, for participating this afternoon. This has really been extraordinary. I also want to invite attendees to go to the Clay Center website, which we could talk about for an hour, which we won't, but just with the scale of resources that are on your Clay Center website, it's extraordinary. So I really want to encourage our attendees to do that. And I want to sort of ask Patty Ribicoff to take us out. But again, thanks so much. And Patty, do you want to say a few last words?
Wonderful program. Thank you all so much. I want to thank Dr. Beresin, Dr. Cohen, and all of you for joining us today. I hope you will take advantage of the tremendous resources offered by the Clay Center. We will be sending you a follow-up email with links to helpful information. Also, Dr. Beresin has graciously agreed to answer any additional questions you may have. We will make sure to include his email address in our follow-up email to you. If you'd like to learn how to support the important work of Dr. Beresin and the Clay Center, please feel free to reach out to me or Michael Johnson in the development department. Thank you again, and best wishes for a happy and safe Thanksgiving. Please stay well.